All right. Welcome back to the Resurgence Athletics Podcast. My name is Dr. Ryan Goodell.
My name is Dr. Lucas Noguera.
And if you are watching, you can probably see we're in a different space. New office.
New setup.
We got a brand new office setup, so new podcast look. That'll probably be changing in the future. But this is podcast number 10.
All right.
We made it to 10. And today we wanted to talk about, originally we were going to talk about GLP-1 drugs, right?
Yep.
And we were thinking about it a little bit more, and we were going, maybe it's kind of like jumping into the middle of a story, and you're not really quite set the stage yet. So maybe we need to start back at the beginning, right?
Yeah, let's give them the history.
So we got to go back to kind of the history. If we're going to talk about GLP-1s, I think we also need to talk about insulin and diabetes and even the obesity topic of, just how did we end up in the position where we were using GLP-1s and insulin to combat a lot of the health problems that people have nowadays.
Sure.
And, to really understand that, you need to know where we came from and how we got to where we are today. So we're going to start with the history and kind of the story of how insulin became a thing before we even get down to the topic of GLP-1 drugs and why their use is important and the things that those drugs can, offer, but where that fits in the whole spectrum and continuum of things and where people have been going to try to combat some of the issues that we deal with, either with controlling blood sugar and obesity and trying to, overall put people in a healthier position to have better health outcomes, So I think that's where we wanted to start.
Sure, yeah. That sounds good to me. Let's jump into the actual word itself, right? So diabetes mellitus, right? So diabetes comes from the Greek word to siphon, which is basically consistent with some of the symptoms of diabetes, which is to pass through, passing through of frequent urination, frequent thirst, and then mellitus is derived from the Latin word sweet, right? So that's how they came up with the name for the actual pathology.
Right. And so that as far back as 2nd century AD, right? So they have had an inkling about that for a long, long time. And they didn't really start to figure out exactly, what the cause of that was until I believe it was the 1700s.
I believe so, yeah.
Was when they started to hone in on that. And in the 1880s, I believe 1889, it was two German scientists.
Yes. Don't ask me how to pronounce their names.
Do you remember their names?
I think
I have their names here. Oscar Minkowski and Joseph von Mering in 1889 were two researchers in Germany who discovered that if a pancreas, which is the organ that makes insulin, is removed from an animal, that animal would quickly develop diabetes complications and pass away. I believe it was within 70 days. It was pretty quick.
Oh, yeah.
And so that kind of started to clue them in on, this pancreas organ is important in regulating our blood sugar levels. They didn't know exactly why at the time, but
it was still a milestone, right? To just know the function of how important that pancreas actually is for the organism that they looked at there.
Right. And so that let their attention hone in on the pancreas. And it wasn't until later that they found that there was a little cluster of specialized cells on the pancreas called the islets of Langerhans, which are beta cells, right? And those create the hormone that we know as insulin, which I think is I've run into this a couple times where if you try to describe insulin to people, it's not just something that we have to take. Like just because you're diabetic, you don't have to take it. Our bodies do make insulin, which is distinctive of I think about, anti-inflammatory medications. Like our body doesn't make ibuprofen naturally, right? So it is reasonable doubt to be like, hey, maybe we don't make insulin. Maybe we have to take it ourselves. But no, our bodies do make insulin. It's just sometimes problems happen with your pancreas that cause our bodies to not produce it. So specifically what they were trying to find at the time was with type 1 diabetes. And in type 1 diabetes, that's autoimmune. So it attacks your pancreas and it attacks those islets of Langerhans, and that stops our insulin production. So your body is literally attacking the thing that makes the insulin for you. And that's
those are your insulin dependent folks, right?
Right. So those people are dependent on the insulin to survive. So that's originally what they were trying to find this for.
Yep.
That later transitioned into type 2 diabetes treatments and things like that. And now there's a whole slew of other things that they use. But they did discover that the pancreas was the actual thing that makes us secrete insulin, which helps control our blood sugar. Oh. So not until later on did they discover, the two different kinds of diabetes. And there's also a bunch of different subgroups of that right now. That includes like gestational diabetes as well. So prior to the discovery of insulin, what were some of the treatment methods they were using?
So a lot of it was diet. So they were trying to cut out a lot of the carbohydrates. Mm-hmm. And we actually saw that a lot of it led to starvation, even cases of where people were dying from not getting the proper nutrients that they should be getting in their bodies. So that's kind of scary.
Right. Some of those diets were super restrictive. I mean, based on what I saw, they were even down to like 450 calories of food a day. It was basically just starvation.
Insane, yeah.
Right? And
not a good solution.
Some people were dying of starvation instead of the diabetes that they were trying to treat, which is insane. And I think even earlier on than that was in the period of like bloodletting. They were doing some of that. Just wild things. I mean, they were close to trying to figure out what to do. They were kind of had an idea, but they didn't really have any idea how we regulated our blood sugar.
Exactly.
Right. And so, following that, it wasn't until from 1889 until I believe it was 1920s. 1921, they discovered how to synthesize this insulin. And these two researchers out of Canada in Toronto, their names were Frederick Banting and his assistant, Charles Best, figured out how to remove the insulin from a donor pancreas, essentially, and then synthesize that down into a usable compound that we could administer to people. So in 1922 was the first administration of insulin to a 14-year-old boy who was at the hospital who had type 1 diabetes, and they administered the insulin, and those symptoms quickly resolved. His blood glucose dropped within 24 hours, almost back to normal levels. So that was kind of the validation that this insulin stuff could be used on humans and it could work. And that was a huge jump in progress for people. And then they needed to figure out a way to make this commercially, right? And do you remember who they commercialized it with?
I believe
they reached out to.
Was it Eli Lilly?
It was.
Yeah.
All so Eli Lilly, I don't know what they were doing at the time. But I think the researchers at Toronto reached out to them and asked them if they could commercially make this stuff. And at the time, they had to take donor pancreases to synthesize this all down. I believe they ended up using cows and pigs in that whole process. And we don't do that today. They make it biosynthetically now. But that's how they had to make it originally until we could figure out how to make it in a lab ourselves. And now that's widely used today. But that's something that not a lot of people know is that insulin's been around for over 100 years. Over 100 years of insulin. And that's quite the history to it. So we've been using this now for a long time, and we've come a long way. But for what insulin has done, it's also lacked in a couple certain areas, right? So people still struggle with diabetes, and there's different actions depending on the type of diabetes, why you have elevated sugar levels. So we see that with type 2 diabetes, you're insulin resistant. So you can still make insulin, but you might not make enough, or the area that it's acting at with the receptors that sense insulin to say, hey, let the sugar into the muscles to use that up. Like that doesn't have that key mechanism to open up those pathways. So they've been a little bit more creative, and they've discovered some other ways to help lower your insulin level, not your insulin levels, your blood sugar levels. But that's kind of where we have to start, right? So that's where we started with insulin to try to treat type 1 diabetes. It's now progressed into the treatment of type 2 and the other forms of diabetes. Sure. And that's also a huge part of, also a huge part of diabetes is, the increase in obesity rates as well.
Oh, yeah.
Which kind of sets the stage for the GLP-1 drugs use later on.
Oh, yeah.
And I think moving forwards in our discussion about this, I think we need to talk a little bit about, the different types of diabetes. So we were going to discuss that a little bit in a future episode. We're also going to talk about exercise and how we actually use carbohydrates, because I think that's a underappreciated aspect of this whole process. Is like under normal conditions, when we eat sugars and things like that, what does our body actually use them for? How do we burn them in exercise? Yeah. And what is the physiological mechanism for that? Because we do need carbohydrates at the end of the day.
And if you understand that, you understand why that method of such a restricted diet did not work out and was leading to starvation, right?
Exactly. So we need to understand, the energy metabolism of it. We need to understand how exercise, which is a very good treatment method for diabetes, helps control blood sugar. And when we do exercise, what does that stimulate physiologically that can contribute to either preventing or even in certain cases of diabetes, getting rid of it. Yeah, that happens if you're diligent about it. That is something that can happen. That's also an underappreciated thing, I think, about exercise and diabetes, is that people don't realize that if you do exercise and we eat well, if you're pre-diabetes or even have diabetes, type 2, you can reverse it and abolish it, and we can get rid of it. That is a harder process, but it is possible. And then that gets us into the conversation about GLP-1 drugs and their use and how those fit into the whole scheme of things, right? Because that has allowed people to lose tons of weight. Have you seen anybody on those drugs
I have, actually,
in clinic?
And from what I've seen, like you said, there's drastic weight loss. My big concern is what we'll jump into later on in a different podcast, but where all the weight loss is coming from, right? Is it just from, fat, or is it also coming from muscle mass and whatnot?
Yeah, and they are very effective.
Yeah.
I will say they're very effective. I've seen them do amazing things. But there's also things that they don't do, and I don't think they highlight a lot of those. Just a brief overview of that is like, with weight loss, there's certain health outcomes you can expect. So you see a lot of these things in the news articles and things like, GLP-1 drugs do this, GLP-1 drugs do that. Now it does this, now it does that. And a lot of those things are concurrent with, if you lost weight via exercise, you would also see those same effects. So a lot of the positive benefits of losing weight with GLP-1 drugs are the same effects and positive outcomes you would see with exercise.
Sure.
So I think that's an important consideration to take as well. But moving forward in that conversation, everybody's experience with either diabetes or GLP-1 drugs or obesity or, the slew of things that go along with that, everybody's experience with those are very individual, and life circumstances are different, and everybody knows somebody, I think, who's been affected by that. So, and just thinking myself right now, I have tons of friends and family that, have struggled with those things. And there's so many factors that go into that.
Oh, yeah.
And so everybody's experience is a little bit different. Everybody's viewpoint on those things is a little bit different. So I think, that's something you have to be aware of when you're working with those individuals as well. So that's why there's no broad stretching general program that people can follow. It's like so individualized, and you need to have those conversations, and it's multidisciplinary. Like it's not just working with your trainer or a nutritionist, it's working with your doctor or endocrinologist, and do they all work well together and can help you navigate this whole process. If that's something that, is a problem and you're trying to fix or you're struggling with, those are all individualized things as well that people need to be aware of and empathetic to. And keeping that in mind as we're talking about these topics, everybody's circumstance is different. So we're going to go through these one topic at a time. If you have any questions or want clarification on anything, I would love to hear from you guys. That's definitely something we want to have an active conversation about. And in coming forward, I think we're going to talk about the different types of type 1, type 2, and all the other types of diabetes. We're going to talk about exercise and carbohydrates, and then get into the conversation of GLP-1 drugs, which is what we were trying to do to begin with. Yeah. And then we'll finally get there, right? Anything you want to add?
No, I feel like, I think knowing all the facts like you're mentioning is important, right? So you don't sell yourself short. If you are taking some of these drugs, just knowing that, like you said, exercise can do the same thing for you. It might take you a little longer to get there, but long term, you might, see more benefit from that.
Yeah, absolutely. So follow, subscribe, click all the buttons everywhere. Follow along. We're going to head on this journey together, and we'll see you next time.